Hi, this is Dr. Swapan Nagpal from Sukhsagar Hospital, Amritsar. Today I'm going to talk about a disease that has been spreading like wildfire in this region for the last around 2 to 3 weeks. So I'm going to talk about dengue today. So dengue is a mosquito-borne infection spread by the mosquito Aedes aegypti. And you remember this is a day-biting mosquito and breeds in clean water. So that's where the starting of prevention comes to. But let's talk about its symptoms. So a patient who has dengue presents to us with complaints of fever, headache, severe body aches, nausea, sometimes abdominal pain, and some of them have a very severe pain at the back of the eye. So remember, if you have any of these symptoms, you must consult your doctor for checking if you have dengue or not. Right. The incubation period I get commonly asked, that means what is the time duration between the mosquito bite and the occurrence of symptoms, is around 4 to 10 days. In my experience, you can say that if the mosquito has bitten you today, in the next week you will start having symptoms. Now, in case you have such symptoms, immediately go to your doctor, because a very commonly misdiagnosed disease in such a time of multiple causes of fever is typhoid. Every Tom, Dick and Harry will tell you that this is typhoid and you have to take antibiotics for it. Whereas if you go into the treatment of dengue, for example, if you're diagnosed with dengue, you realize that the only treatment available to us right now is fluids. So you keep drinking a lot of fluids, around 3 to 4 liters of fluid per day. Obviously, renal patients and heart patients have to be careful about that also. But if you are a normal, healthy human being, you have to take around 3 to 4 liters of water or any other fluids every day. The thing with dengue is you need admission only if you're not able to drink lots of fluids or not able to eat well. That happens when people have a lot of nausea and vomiting. Otherwise, you do not need admission in dengue. Let me explain the course of the disease. So generally in dengue, for the first 5 to 6 days, you might have high-grade fever with chills, with rigors, with headache, with nausea, with abdominal pain, and some other symptoms that can tell you if it's a simple or a complicated dengue. Mild, moderate, severe is the category that medical personnel follow. Now, when the patient starts feeling better after 5th or 6th day, that is when the platelets start going down. So that is when the actual monitoring of platelet count is needed. More than that, you should look at the HB, because if the HB is rising, the hemoglobin is rising, you have to think that the patient's fluid in the blood vessels, that is the intravascular volume, is getting decreased and the patient's blood is getting hemoconcentrated. That's what we have to prevent. Also, it is important to look at the liver function, because liver dysfunction is very common in dengue. Mild to moderate liver dysfunction is acceptable, but rarely it can be severe also. Okay. How do you prevent dengue? The most important thing is to prevent mosquito breeding. Now you have to look for areas where there is clean water stagnant in and around your house and remove those areas. For example, water coolers, flower pots, in your balcony if there is an area where water gets stagnated. Another important thing is to use repellents at home. I personally switch on my mosquito repellent like All Out or Mortein or Goodnight for the entire day, because this is a day biting mosquito. It prevents mosquitoes to bite in the day. And you remember, malaria is spread by a mosquito which bites in the night. So anyways, you need protection from all kinds of mosquitoes 24 hours. The other important thing is to use cream or oil-based mosquito repellents on your body whenever you are going out, or inside the house also if you are going to areas where the windows are open. Try closing down the windows for most time in these times. Otherwise, the mosquitoes will come in through the crevices of the doors and the open windows, and then can cause disease from one person and then spread to the other person in your household. Another commonly used mostly in rural areas is nets. Nets are very effective. Remember to find a very fine net that can cover your bed, but it's mostly not effective in dengue because it's a day biting mosquito and you are not going to cover yourself with a net in the day. Also remember that because dengue has come, that does not mean that COVID has stopped. COVID is still going on. We see sporadic cases every day. So please wash your hands, wear your mask, and maintain social distancing at all time. Thank you.